Hi, welcome to another edition of Hemsi Punch. I'm Will Young, one of the assistant medical directors. Today we're here to talk to you about doing the Easy IO. In the state of Alabama, all advanced EMTs and paramedics have the exact same scope when doing the Easy IO. This is intended to be used when you have the need for emergent or urgent medications or fluids, and should not be used when we can give medicine through other appropriate venues. Let's go over some of the reasons not to use the Easy IO. Obviously, if there's an infection at that site or if there's a broken bone in that area, you don't want to use the Easy IO. Also, if you think there's orthopedic hardware in that joint, if you see a big scar, if they're unresponsive, you might want to consider using another location. If there's a lot of tissue, if the person is morbidly obese and you can't identify the landmarks, you don't want to use that site either. And finally, if they've had a IO in that extremity in the last 48 hours, you also don't want to use that extremity for another IO. There are three sizes of the Easy IO needles. The first one's the pink one. It's 15 millimeter. Currently at Hemsi, only the supervisors carry this. So if you're on a pediatric arrest, they may pull this one out. It's for any patient that weighs between 3 and 39 kilograms. However, all the Easy IO kits at Hemsi have both these needles. The second one, the blue one, is 25 millimeters and it can be used on any patient greater than 3 kilograms. This includes both pediatrics and adults. And finally, the yellow one, the 45 millimeter, it can be used on any patient greater than 40 kilograms. Let's talk about site selection. In the state of Alabama, the adults can use a humeral IO or they can get a proximal tibia IO. Pediatric patients can get a humeral IO, a distal femur, or a proximal tibia. Let's talk about how to find these landmarks. First of all, on an adult patient, the first thing you're going to do with a humeral IO is you're going to either have them put their hand on their abdomen with their hand beside them, or you're going to have them put their palm out and their thumb down if they're laying on the ground. Both these locations will help you find the right anatomical landmarks. For the patient that's on their back with their hand on their abdomen, such as this model is showing, you're going to take your hand and put it over the ball of the humerus. You should feel a nice round ball in the palm of your hand. After that, you put one hand right here on the axilla, one hand on the side, and when your thumbs come together, that's going to be the site that you're going to use for insertion. Let's go over the lower extremity sites. You can use either the distal femur or the proximal tibia. In most pediatric patients, we're going to suggest using the distal femur. It's a lot easier to identify the landmarks and you're less likely to drill through it. Usually you're going to use the 25 millimeter needle, the blue needle for this one. The landmarks for this include going about 1 to 2 centimeters above the patella on the femur. So you put one finger down and that's going to usually be about 1 to 2 centimeters. After that, you can go just slightly medial to that. On the proximal tibia site, you're going to find the landmark of the bottom of the patella, and you're going to go 1 to 2 centimeters below that on the medial aspect of the tibia as well. Again, this is about one finger below the bottom of the kneecap, and on the medial aspect of the tibia, you should feel a nice little flat spot there. That's your landmark for the pediatric patient. When you're doing an adult, it's the same landmark, but it should be 2 to 3 centimeters. That might be 2 fingers below the kneecap on an adult patient, and also to the medial aspect of the tibia. Should feel a nice flat spot there, and that's your landmark for the proximal tibia. Let's get drilling. We've already identified our landmark. Now we need to clean the area. You can use betadine, alcohol, or chlorhexidine. Clean the area, allow it to dry. On this adult patient, we're using a 45 millimeter needle. We have the landmark identified. We're going to remove the safety cap. Once you place the needle underneath the skin, you want to make sure the very first black mark disappears. This ensures you're using the appropriately sized needle. You should still see at least one black mark on both the 45 and the 25 millimeter needles, if you're using either one of those. Once you're in, that's when you start to drill. You should drill until you feel the needle give way and there's less resistance. Stop drilling as soon as you feel this. Just like that. After that, hold the needle, remove the gun. You want to remove the stylet while anchoring the needle. After this, you're going to apply the stabilizer that's in each kit. And after this, you'll also apply the prime set to the area. You want to make sure that you also throw the needle into this little needle holder right here to keep yourself from getting stuck. Let's go over the distal femur site. In the state of Alabama, this is approved for children under 2 years of age. Again, you're going to identify your landmarks, which is about one finger above patella. You're going to clean this area. And for this, we're going to use the blue needle, the 25 millimeter. Remove your safety cap. you're going to insert the needle perpendicular to the skin. You want to insert until you feel the bone. When you feel the bone, the first black line should have disappeared and the second black line should still be visible. If you're still seeing both black lines, you're not using the right size needle. Again, you're going to drill until you feel the loss of resistance, and at that point, you're going to stop drilling. Once you feel that loss of resistance, you're going to remove the drill, remove the stylet, put it in the sharps container, and you're going to attach your extension set. If you can aspirate marrow, that'd be great, but if you can't, don't worry about it. Just attach the extension set. We'll also want to make sure you secure it with the stabilizer. And finally, let's go over the proximal tibia site. Again, your landmark is going to be about 1 finger below the patella on the medial aspect of the tibia. You're going to want to clean this site. If you're running a very young pediatric arrest and the supervisor shows up, you may end up using the pink needle on this. However, it is okay to use the blue needle. Just make sure that you stop as soon as you feel that resistance give and you don't go all the way in. Typically, this has a tendency to possibly go through the bone. So, in this situation, we're going to use the pink needle. We're going to identify our landmarks. We're going to clean the area. We're going to remove the safety cap again. The pink needle only has 1 black line. You should insert until you feel bone. If you insert and the black line disappears, you need a bigger needle. Again, you're going to do the same thing. You're going to drill until you feel the resistance give. Stop drilling. Stabilize the needle. Remove the drill. Remove the stylet. Apply the stabilizer. If you can aspirate marrow, great. If not, attach the extension set. And always throw away your sharps. This is the same process for doing it with adults as well. For our paramedics in the state, if you have a patient that's responsive to pain, you can give them lidocaine to help. You can give them 2 milliliters, which is 40 milligrams. For our pediatric patients, it's 0.5 milligrams per kilogram. After you give the lidocaine, you're also going to want to provide a rapid IV bolus. This helps displace the marrow and will help the IO flow a lot faster. For the adult patient, it's going to be 10 milliliters. Pediatric patients, 5 milliliters. Congratulations on getting your IO. Once the IO is working, we do recommend that you put this armband on, even if you just attempted and were unsuccessful. This helps the facility know that there was an IO attempt or placed in that extremity and no other attempts should be made for the next 48 hours. We also found that EasyIO has a wonderful app. You can find it on the Android or the Apple App Store, and it has great pictures and videos, and we highly recommend you download that. Thanks for watching. The last thing we wanted to do today is do a shout out to some of our crews. We received some compliments from both Crestwood and Huntsville Hospital for a patient that Tony Cece, Keith Burrow, Jordan Neesmith, and Steve Moran all took care of. Tony and Keith identified a critically ill patient, stabilized him, got him to Crestwood, and then Crestwood asked Jordan and Stephen to transport him to Huntsville. Both sides were very highly complimentary of the care. So good job, guys. Way to provide excellent patient care. Keep up the good work because what you do matters. We'll see you next week.